Canine cognitive dysfunction, CCD, commonly known as dog dementia, is a widespread but often overlooked neurodegenerative condition affecting aging dogs. Similar to Alzheimer's disease in humans, CCD leads to progressive impairments in learning, memory, and executive function. As veterinary care extends pets' lifespans, the risk of this disorder increases, with some studies suggesting it may affect up to 60% of senior dogs, particularly those over age 11. The signs of CCD are subtle and develop slowly, making them easy to miss. Owners can use the acronym DISHA-A to remember key symptoms: disorientation in familiar places, e.g. getting lost at home, interaction changes, becoming withdrawn or overly clingy, sleep-wake cycle disruptions, pacing at night, napping less, house soiling, and altered activity levels, apathy or restlessness. Additional signs, A, can include increased anxiety, vacant staring, or unprovoked vocalization. Early detection is critical because cognitive decline can worsen rapidly, and severe symptoms indicate significant, irreversible brain damage. Diagnosing CCD remains challenging. Veterinarians use clinical assessment scales, like the Canine Dementia Scale, CADES, or the Canine Cognitive Dysfunction Rating Scale, CCDR, but there is no standardized live test or reliable biomarker. A recent study using CADES found cognitive dysfunction in nearly 66% of dogs aged 7 and older. However, a definitive diagnosis currently requires a post-mortem brain analysis, which reveals pathological similarities to human Alzheimer's, including amyloid plaques and protein tangles. Treatment options are limited. While there is no cure, management focuses on improving quality of life. The only FDA-approved drug for CCD is selegiline, though its effectiveness is uncertain and it is deemed ineffective for human dementia. Other supportive measures include environmental modifications, e.g., blocking stairs, maintaining routines, increasing walks, and sometimes using supplements like melatonin. The lack of successful pharmaceuticals has spurred alternative research, such as studies at the University of Adelaide investigating whether cognitive training exercises can help dogs with CCD. The condition has significant emotional impacts, straining the human-animal bond as owners grapple with their pet's behavioral changes and their own frustration, which can further stress the animal. Therefore, awareness and proactive veterinary consultation are essential. Notably, dogs with CCD are emerging as a valuable translational model for human dementia research. Unlike laboratory rodents, pet dogs share our living environments and are exposed to similar lifestyle risk factors, making their disease progression more comparable to humans. Research initiatives like the Dog Aging Project at the University of Washington study canine aging to benefit both veterinary and human medicine. Scientists argue that understanding CCD could provide critical insights into Alzheimer's disease, potentially accelerating the development of therapies for both species. In conclusion, canine cognitive dysfunction is a common, serious condition that requires greater owner vigilance for early signs. While management options exist, the field needs better diagnostic tools and treatments. Ongoing research not only aims to improve the welfare of aging dogs, but also holds promise for advancing our understanding of human neurodegenerative diseases, highlighting a unique and mutually beneficial research pathway.